Hi guys, today I am talking about a subject that keeps coming up amongst all the women that I work with and play with and are friends with and see in my office as well, but are so embarrassed to actually talk about it. It's dry vagina. Yes, it's in your face, dry vagina. That's what I'm talking about. Now, maybe you don't even know if that's what you have. Maybe you just, know that you always get a bladder infection after you have sex. Maybe sex is really painful and you always need to grab for the lube, which is not very sexy. Maybe you get chronic yeast infections, or maybe you just have this always irritated, itchy, burning feeling. And all these things add up to not wanting to have sex because it's painful and not, sexy and not comfortable. And then we have these after effects. And then it actually affects our relationships because we're so embarrassed and ashamed to talk about it that we don't talk with our partner about it. Then they think that they're not turning us on if we're always having to grab for the lube. So it's this vicious cycle. And your sexual health is just as important as your physical health, your mental health, your spiritual health, emotional health. So this is really important to really reclaim that juiciness from the inside out. And how do we do this? Why is it even happening? When you get dry, you actually are losing your hormones. So it's your body's message and signal saying, hey, we're not having the hormones that we used to have. And the number one hormone that typically causes that is estrogen, loss of estrogen. And not every woman needs estrogen right away, especially if you're younger and still having a period. And that being said, this is a symptom that you can actually have as early as your late 20s, early 30s. This is not something that, just happens when you get older. So I'm really trying to spread awareness so that people can have a nice, healthy, vibrant sexual life because you deserve it. So like I said, estrogen is the main culprit for the actual dryness, but it's not the only treatment for it. Like I said, if you're too young for estrogen, you're still having a period, if you can't have it because of various reasons, there are other options out there. So one of the main ones is testosterone. Yes, we need testosterone too. It's not just for the men. And testosterone has so many other health benefits. It actually increases your lean muscle mass, which ultimately prevents your risk of developing osteoporosis. But when you apply testosterone to your lady lips, you actually get a better absorption there, a little bit of conversion over to the estrogen that helps to actually rebuild some of those tissues that have gotten really thin, that get really irritated, even just with wiping, going to the bathroom. So not only is it helping to lubricate, but it's actually helping to build the tissues back up so that you have stronger, more intense orgasms, because that's one of the signs of your vaginal area kind of shriveling, is that you are dry, you have to concentrate more for your orgasms, and they're not as intense as they used to be. So these are all symptoms of hormonal decline, and you deserve to have really robust, strong orgasms. And I'm here to help you with that. So testosterone would be one way to boost it. DHEA is also a hormone that's a building block for testosterone. And DHEA can actually be inserted vaginally as a capsule, so you don't get any systemic absorption of the hormone for those people that are really trying to stay away from any systemic absorption. And you can actually, it's proven to be safe in women who have had breast cancer because there is no systemic absorption. So there is hope for those people. And it's just a capsule that you insert nightly. I always tell my patients to titrate to juiciness. Some people only have to put it in 2 or 3 times a week. And it not only helps with the secretions, but it helps again with that muscle tone. It also helps with your sensitivity, again, so you're more turned on quicker, and it boosts your libido or your sex drive. So it works from all those different angles. It's not just about making you juicier. So that's one other way to boost it. Now, if you have stopped having your period, you are ready for estrogen and qualify for it. Estrogen is a way to kind of reclaim that juiciness from the inside out. So it is working from the inside out. Estrogen is also heart protective, as well as so many other benefits. So that's another way to increase that juiciness, would be either oral estrogen, which offers the most heart benefit. For people that want to use a vaginal estrogen, you can do that as well. There is some minimal absorption with that, not like the DHEA, there's none. So that's another option for you. Now, the other thing that's been really kind of publicized more lately are all of the different procedures that you can have, the ultrasound procedures, the tightening procedures that help with that dryness. And what it does is it actually stimulates growth of the tissues to actually get more secretions, but it's really like a quick fix. It's not giving you all those other systemic benefits. If we're talking about the systemic route that we're using, whether we're doing testosterone or estrogen, and it really is just localized to that area to increase the secretions, can sometimes help with the muscle tone as well, but doesn't really work on that sex drive. You have to actually want to have sex. So that's kind of my take on some of the procedures. You can really change the world down there just by using some of these other routes. And I would highly encourage you to try those first. And then if you're still needing some assistance in that area, you can do one of those procedures, and it's just kind of a nice add-on. Now, the other route that you can go that is like no hormones at all are what we call scream creams. And these are creams that help to improve the blood flow to the clitoris and to the vaginal area so that you have more secretions, and also, again, the intensity of your orgasms. So again, this is a hormone-free route to be able to use, but that's another option for you to use. And you can apply it before you get intimate with your partner. So there's no reaching for lube that will, cause any discomfort there. But I really, really encourage you to talk with your partner, and because if there's no conversation, there's a lot of disconnect, and intimacy is something that really is needed also to have a really healthy, vibrant sex life. So I really encourage the conversation, and if anybody has any questions or comments, please DM me. And these are all options that you can talk to your hormone optimization physician about. You can talk to your gynecologist about, but I will tell you that a lot of the traditional physicians are just not trained in this. I mean, I know for myself, when I went to medical school, there was no conversation about sex. There was no conversation about how to have the conversation with your patients about sex. And it's just getting in there and having the conversation and not being embarrassed about it. I remember, kind of lowering my voice when I would talk to patients, how's your sex life? And it should be great, like, how's your sex life? Because when you're in flow everywhere, everything flows. It definitely, seeps into all of your relationships, just your inner sexiness, inner juiciness, inner vibe. So you deserve to have a healthy, vibrant sex life up until your 80s. When you're 40 or 50, you still have half your life left. So I really encourage you to advocate for yourself. There are answers. You're not alone. This is not something you just have to suffer with or part of getting older. There are answers out there. So again, if you have any questions, please DM me, and I hope this was informative to you. You deserve to reclaim your juiciness.